Okay.
Hello, Nicole. My name is Taylor Campbell, and I'm a registered nurse specializing in the operating room. How are you doing today?
Hi, I'm doing well. How are you doing?
Good. Are you able to see and hear me okay?
Yes. Yep. Everything's perfect.
Wonderful. And I'm well. Thank you for asking. Before we start, can you please again confirm your name, your full name, and your date of birth for me?
Yes, it is Nicole Smith and date of birth 5/13/1993.
Thank you. Is there anyone else with you today for this telehealth visit that you would like to introduce?
Nope, just me today.
All right. It's just me in here as well by myself. I want to assure you that everything we discuss today will remain confidential. This telehealth visit will last approximately 10 minutes, and I will be providing you with some important information about preparing for your upcoming anterior cervical discectomy surgery. So if you have any questions at any time, please feel free to ask. Also,
Okay.
if you
That
happen to
sounds
notice me writing or looking around, please don't worry. I'm just taking notes to ensure that I capture all the important details of our conversation today.
okay. Yeah, that sounds awesome.
All right, so let's get started. Can you tell me a bit about your upcoming surgery and any concerns you might be having?
So I'm having surgery. They scheduled me for an anterior cervical discectomy next month. But really I'm just feeling nervous about the whole process. I've never had surgery before and I'm a pretty anxious person, so just probably a bit more stressed than I should be.
Okay, I understand it is completely normal to feel that way. Many patients feel a little anxious before surgery, but my goal today is to help you feel more prepared and comfortable. So, we're going to go through everything step by step just so you know what to expect. First thing I want to talk about is what you can expect before surgery. Have you received any instructions from your surgeon yet?
He mentioned a couple things, but honestly, I don't remember everything.
Okay, that's no problem. I'm going to go over the key points with you. Before your surgery, it's really important to follow any fasting instructions that they give you, which usually just means not eating or drinking anything after midnight the night before your procedure. This helps reduce the risk of complications during anesthesia. Do you have any questions about the fasting instructions?
Nope, just nothing to eat or drink the night before.
Yep, correct.
Alrighty.
All right. Then there's a few more things that I want you to keep in mind. So I'm going to break them down individually. The first one I want to focus on is medications. I want you to make sure you follow your doctor's instructions about which medications to stop, or take before your surgery. This is going to include over-the-counter products, your vitamins, your herbal supplements. Um, the second one I want to talk about is hygiene. They are going to give you these special CHG wipes. The instructions are to bathe or shower the night before or the morning of your surgery, but they want you to avoid using any kind of lotions or perfumes, deodorants, or even nail polish. Okay, do you have any questions about those two things?
Nope.
Okay. And then as far as clothing and personal items to bring with you the day of, it's our recommendation that you wear comfortable, loose-fitting clothing on the day of your surgery. And we ask that you leave any jewelry, body piercings, makeup, or valuables that you would typically have on you. We ask that you leave them at home. Okay.
Okay.
And then do you use a CPAP or a BiPAP machine for sleep apnea?
Yes.
Okay, you do. So you're going to want to bring the machine, your mask, and the tubing with you the day of your surgery, just in case the surgeon anticipates you having to stay overnight for observation.
Okay, I can do
Um,
that.
okay, good. And then they may require you to do some testing before surgery, such as blood tests, x-rays, EKGs, or even a pregnancy test. They're going to want you to do a pregnancy test the day before your surgery.
Okay, alrighty.
Okay. And then just as far as paperwork, if you have an advance directive, you're going to want to bring a copy of that with you to the hospital.
Okay.
And then it's important for us afterwards to be thinking about your transportation and your support system. So we're going to need you to arrange for a responsible adult to drive you home after the surgery and stay with you for at least 24 hours post-surgery. Obviously, if you're staying overnight here at the hospital, you'll be surrounded by the nurses, but if you have a family member that you're more comfortable with, then they can come as well.
Okay, my husband will be there with me.
Okay. Additionally, we're going to go back a little bit. We want you to avoid smoking or any kind of alcohol for at least 24 hours before the surgery because these substances can interfere with your anesthesia and the recovery process. Do you smoke or drink at all?
I do not smoke, but I will have a drink, every now and again, just socially.
Okay. So like I said, it's best to avoid alcohol for at least a day before your surgery. Now I'm going to go back even further. We're going to go back to the medications. Have you been given any specific instructions about the current medications that you are on?
So I'm on a blood thinner, so they did
Mhm.
tell me to stop taking my blood thinner a few days before surgery.
Okay, yes, that's correct. So blood thinners can increase the risk of bleeding during surgery. So you want to make sure to follow your surgeon's instructions on when to stop and restart that medication. And if you're unsure about any other medications, it's always best to ask. Do you have any other medications or supplements that you take?
So I just take a multivitamin in the mornings, and then sometimes if I get a headache, I'll take like an ibuprofen, but nothing else really besides that.
Okay, those are also important for us to inform your surgical team about the supplements and even the over-counter ones like the ibuprofen, as they also can affect your surgery. Your surgeon might tell you to stop taking those as well. Next thing I want to discuss with you is some things you can expect on the day of surgery.
Okay, sounds good.
Okay, so on the day of surgery, you're going to want to arrive at the hospital or the surgery center a few hours before your scheduled time. This is going to allow the preoperative team to prepare you for your procedure. You're going to be asked to change into our hospital provided gown and remove any jewelry or accessories that you may have worn. Again, if you recall, we had asked that you leave them all at home, but a nurse is going to be there. She's going to check your vital signs. You're going to meet with our anesthesiologist during that time as well to discuss your anesthesia plan. Do you have any concerns about anesthesia?
So just a little nervous about being put to sleep. Again, this is just my first surgery, so I just get very nervous about any little thing. So just feeling those nerves.
Okay, and that's a very common concern. The anesthesiologist is going to be with you throughout the entire surgery to monitor you and ensure your safety. They're going to explain everything and answer all the questions that you have before you go back for your procedure. And it's their job to make sure that you're comfortable and safe. After the surgery, you're going to be taken to a recovery room where you're going to be monitored as you wake up from anesthesia. You might feel a little groggy or nauseous, but this is normal and it will pass. Do you have any questions about the recovery process?
Do you know about how long after the surgery I will have to stay in the hospital?
The length of your hospital stay can vary, but for an anterior cervical discectomy, it's usually a short stay. Some patients go home the same day, while others might stay overnight for observation. Your surgeon will give you specific instructions based on your individual case. And then once you're home, it's important to follow all post-operative care instructions to ensure a smooth recovery. This is going to include taking prescribed medications, attending your follow-up appointments, and avoiding strenuous activities. Do you have a support system at home? You said your husband was going to be there to help you during your recovery.
Yes, he will be with me the entire time.
Okay, that's really good to hear because having a support system at home can make a big difference in your recovery. So make sure you communicate with your husband about any help that you might need. And then after surgery, you can expect to feel some discomfort and fatigue, which is also completely normal. Pain management is going to be an important part of your recovery. So we're going to make sure that we have those medications on hand as directed. You may also experience some swelling and bruising around the incision site. This is a normal part of the healing process, but it should gradually improve over time. It's important to keep the incision area clean and dry to prevent infection. I want you to follow your surgeon's instructions on how to care for the wound, including when you can shower and how to change any dressings. You're going to also want to avoid any strenuous activities such as heavy lifting for a certain period of time, which again, your surgeon will specify. Gentle activities like walking can help improve the circulation and speed up your recovery, but you need to listen to your body and try not to overdo it, okay?
Okay.
Lastly, I want to touch on some of the signs of complications that you should look out for. While the complications are very rare, it is important to know what to look for. So if you experience severe pain, excessive swelling, redness, or discharge from the incision site, or if you have a fever, you should contact your surgeon immediately. Do you have any questions about all that information I just gave you?
Nope. I think
Okay.
you've been very clear with everything.
Okay, good. I'm glad to hear that. Remember, it is completely normal to feel a bit anxious before a procedure, but being well prepared can help ease some of that anxiety. I'm going to be sending over an email of everything that we discussed today so that you can refer to it later. But if you have any questions, don't hesitate to reach out to your healthcare team or myself. I want to thank you again for your time today, and I wish you a smooth and successful surgery.
Awesome. Thank you so much for all your help. And yeah, the email will definitely be helpful just for me to refer back to just because we kind of went over a lot of information. But I definitely feel a lot more comfortable now that we've talked about all of these things. Like I said, I'm just very anxious, but kind of knowing what's going to happen or what to look for, it really helps a lot. So thank you so much for taking the time to talk with me today.
Absolutely, you're certainly welcome. And like I said, if you have any questions later, don't hesitate to reach out. We're also going to be scheduling a follow-up appointment to check on your progress after the surgery. So we'll be chatting again. But yeah, thank you for your time today, and I wish you the best.
Awesome. Thank you so much. I look forward to speaking with you after.
Absolutely. You take care, okay?
All right, you too. Bye bye.